Dr. Ankita Jaiswall, and I welcome you all from India. I have graduated from Meerut and I have done my post graduation in orthodontic department from Lucknow. And recently, I've been awarded as the Superwoman 2022 as for COVID warriors in the healthcare segment. And I am very obliged to give a lecture on the Beyond Orthodontics innovations in recreating aesthetic smile. I hope I'm audible now. Hello, am I audible?
Yes, you are audible. Your voice is clear. You can proceed with your presentation.
Okay, can we shift to the next slide, please? Basically, what orthodontics is basically people, they want to be beautiful and they want to look beautiful. And that's why they are into that field. So beauty is in the mind of the beholder, and each mind perceives a different beauty. It was famously said by the writer Margaret Walt Hungerford. So, and you all know that a beautiful smile is a gateway to the world. In our field, we basically plan our treatment according to how to design the smile. And we deal with teeth and the hard tissue. So we have some limitations of soft tissue. We can only play to a limited part. But in this lecture, I will go beyond that part and we will also encourage the new soft tissue techniques in this. What is innovation? Innovations is basically simply the adoption of the latest technologies and concepts which are already available. And also, it is something established, especially by introducing new methods, ideas, technologies, or products. Can I move to next slide, please? I'll be covering the recent technologies, not the conventional part of orthodontia. So I will be moving from the most recent to the less recent one. That is Invisalign, Invisalign Teen, Incognita, TAD, clear braces, the high-tech alloy wires, digital X-rays, digital 3D impressions, CBCT techniques, then the clear retainers, and the most prominent part, which goes beyond orthodontics, is the cosmetological procedures. Next slide, please. Okay, so first clear or facts. What do you think that the people notice first when they meet someone? Obviously, your smile. 47% of people observe your smile first, then your eyes, and then the clothes, smell, and hair follows it. Next slide. 15 fascinating facts about smile. See, I am talking more about smile because this is what we are looking for if we are going for any aesthetic treatment. Final, the best smile of we can satisfy the patient with their smile. This is what our work has been done. So what are the 15 fascinating facts about smiling? It actually is enhance our moods, enhance our immune system. It relieves our stress. Next slide, please. It is a universal sign of happiness. We are more smiling at home than at work. Well, it can be vice versa. Depends on your culture. Then smiles is actually taken 53 facial muscles, so it's a very good exercise for your face. And a smile makes you seem more confident and it is making you more trustworthy. Next slide. So with the smile you get promoted, it becomes making you more attractive, it makes you more approachable. And do you know there are 19 types of smile? So there are 19 types of smile which make you more approachable. Next slide. Now coming on to the most latest trends which you all heard, that is clear aligners. The first and the foremost company which comes with the clear aligners in Invisalign. Invisalign basically deals with the clear removable aligners which straighten your teeth, smile invisibly. means you are smiling and nothing has been shown. See, the most fear factor today is that we are connected with social media and we are very much connected with thousands and thousands of people at one instant. So if we are undergoing with some metal braces, some conventional treatments, then we don't want to look happy and we don't look happy with those treatments. See, it's a compulsion for us to get an orthodontic treatment done if our teeth are irregular and our face is not looking good. But now we have an alternative to it, and it is a very good alternative. These are clear aligners and they are invisible. You're smiling, your teeth are correcting, you have your teeth in position, you have your smile on up to date, and nobody can know that you're undergoing treatment. So if you are hesitating with metal brackets, please go for metal-free Invisalign or clear aligners. And they correct all the malocclusions, everything in proper position. Yes, it takes a lot of time for Invisalign, more time than the metal braces, but it is worth the time. Next, please. This is the difference between the metal braces you own and the Invisalign clear aligners. You can see in this slide, there is a clear difference why now the clear aligners is in demand and everyone's choice for orthodontic treatment. Next slide. There is a segment of Invisalign, which is Invisalign Teen. Since the teenagers are very much excited for their straighten of teeth and very conscious about their teeth arrangement and how they smile and how their face and appearances looks. So they used to go for orthodontic treatment, and it is mandatory for them to go in that age because that is the correct age for that treatment. And the traditional metal braces can make eating, speaking, and maintaining cleaning teeth challenging. So Invisalign Teen has become the choice for everybody who is going for orthodontic treatment. Next slide. Incognito. See, I have said that earlier also, I am going from the most recent to the less recent one. So Incognito is basically you all know about the lingual orthodontics. We have moved the braces from the label side to the lingual side of the teeth. But Incognito is basically generated by the 3M technologies, and it is the CAD-CAM technology. We don't need to put each and every bracket on the teeth on the lingual side. It is CAD-CAM technology. It is customized. You get the tray customized. You just have to fix it in the patient, bond it, and the work is done. So this is Incognito. If your patient is doubtful about the aligners, they are doubtful, they are very much trustworthy that only the brackets and the wires can do their work, and they don't want to show their metals and brackets on their teeth, this is the choice of treatment. Incognito not only gives the lingual orthodontics, not only treat the case faster, it is easier for the people to adapt because they are confident while the treatment is going on. Next slide, please. See, this is the treatment between Incognito and the conventional metal brackets. You can see they both are undergoing orthodontic treatment, but one is visible and one is not. So this is the basic criteria for going if anybody wants it invisible, but they want the brackets in the conventional way. Next slide, please. Next slide. Yeah. TADS. When we are talking about innovations, this is one innovation which has actually created a boom in our field of orthodontia, because we always talk about implants, and implants is such a hot topic for dentistry. But in orthodontia, we talk about mini implants and micro implants, such tiny, tiny screws, which actually relieve us and for our force exemption to the components, because we put the screws in the bone and the teeth are actually not putting any effort. So it has lessened our technique. It has lessened our technique sensitivity. It has lessened the chair side time. and it gives an equal force. It has given us a good component for when we are pulling, when we are pushing or lifting or intruding or extruding the teeth. It is easier to do that with these tabs. So these are the temporary anchorages devices, and they all help us to straighten the teeth in any direction with proper force and proper equipments. Next slide, please. So these are the tabs, as you can see. They are small titanium mini screws or micro screws, which are incorporated in the bone, and we put all our auxiliary forces through these tabs. And since we are putting all the auxiliary forces through these tabs, the other teeth, they are not taxed with the forces. So the proper alignment with proper arrangement and proper force can be delivered during the orthodontic treatment. Next slide. Well, when the metal brackets were off the track and the people were thinking about something which is they were not thinking about the clear aligners. Aligners come way beyond when there were brackets in the market. So they think of making brackets invisible. The brackets are there on your labial surface, but there was no metal. So they came up with a material called ceramic. So in ceramic, there are two types of things, monocrystalline and polycrystalline. Monocrystalline means from one crystal they make the bracket cube. Polycrystalline means they make from the different crystals. And these are clear brackets. They are on your labial surface, but they are not visible at all. So this is something which gives them an off track from the traditional metal brackets. They are stain resistant. We talk about stain resistant in India because we use turmeric in our food, and turmeric is a big color putting in this brackets, and they are basic reason for the stain for. But the ceramic, they are stain resistant and they have a better adhesion to the tooth than the metal brackets. So this is something which comes actually just after the metal brackets, an innovation just after the metal brackets, that are clear braces, that is ceramic brackets. Next slide, please. See, this is the difference which is clearly evident. One side is with the metal brackets and the metal wire, the other side is with the ceramic bracket and the metal wire. Even now we have with the NASA has taken all the they have given that discovery of the coated alloys and the wires with the color coated and tooth colored wires. So even the wire is not visible in ceramic treatment. So this will be an alternative for those people who don't want to go for lingual orthodontics. They want to continue with labial orthodontics, and they are seeking for some economic range also and not visible brackets. They don't want a visible bracket in an economic range, and they don't go for lingual orthodontics. So this is your choice of taking a ceramic bracket with a tooth colored coated wire. So it makes the look of the component clear. That's why they are called clear brackets. Next slide, please. Now moving on to the next innovation, which is a big innovation in our dentistry, that is digital X-rays. Digital X-rays are actually gripping very faster, and their quality is far better than the traditional ones. You can imagine in the old days we have to develop every X-ray, and there is a whole lot of procedure for developer, for etcher and everything, the shootout time and everything, the location, the position. We have to keep in mind every small little bit thing, and it is very technique sensitive. The instruments, the machine for loading the X-ray has to be on wall mount, and you have to go there and get your X-ray shooted. But with digital X-rays, there come the portable X-rays, and which makes everything, shooting your X-rays and developing them and seeing them on your laptop handy. So everything is very portable, and this is one thing which is must and is a boom, and it's a good thing for a dentistry, that there is a digital X-ray there, which actually is 80% less radiations and far better with your quality image you can have. If you are going for any softwares like Vista scans or all portable X-rays, they give you some inbuilt software keynotes in them, where you can change the contrast of the image on your laptop. You can change what you want to see, the specific area you can enhance, you can contrast, you can zoom in or zoom out in that, and you can actually diagnose very properly what you want to see and what is the location. You can actually diagnose with efficacy, with more efficacy than the conventional X-rays. So this is one innovation which is actually a very great innovation in recreating smiles. Next slide, please. Now, digital 3D impressions. This is one thing which is very in, because when the aligners came into practice, initially what we used to do is we used to take our impressions and we used to deliver it to the lab, and there was a whole lot of process, that sanitizing that impression, then keeping it in the packets, and then delivering it without making any harm to those impressions. So then the market comes with the digital 3D impressions, where with just an instant intraoral scanners, you are scanning the whole impression. Your impression is on your laptop, and just on a click it is in the lab. So there is no use of any messy impressions, no technique sensitive. You don't have to be very technique sensitive. The patient does not have to have a gag reflex, or they don't have to feel very bad in their mouth. Whatever their bad experience about impression is just, you are from the scanners, you are scanning each and every nick and corner, inch, centimeter, everything of the oral cavity in your on your screen, and you can moderate it again and again without harming the patient, without making the patient uncomfortable. You can take and scan as much as you want, according to your satisfaction and your patient satisfaction. Even when your patients see that impression on the screen, and you can actually teach them what has to be done in the with the help of that impressions, and it you can actually tell them the treatment, and it is more comfortable to tell them the treatment. It is more precise, and it is more immediate. With one click or from your laptop, you can deliver it to the lab, and they can easily do it. Because initially they used to create a 3D scan of the impression, which physical impression you used to send to the lab, and then they used to create the aligners from that 3D scan. Now that step has been avoided, because you are directly taking a digital 3D impression. So this plan maker scan or plan scan or itero scan, there are many scanners in the market which actually have lessened the chairside time, the patient compliance, and your messiness of the impression material, everything due to this digital 3D impressions. Next slide, please. Now, clear retainers. See, if we are going for an orthodontic treatment, the most important step is having retainers. Retaining what we have achieved is the master key to our treatment. If we are lacking on the retaining part, then surely we are getting a relapse case in future. So if we are good with the retaining part, we are good with the patient, we are good with making the trust, and as a doctor, we have done the good work. So initially we used to have those heavy wires poly retainers, which then transformed into the lingual bonded retainers, but the wire segment was there. So we changed it to the clear retainers. They are also called the Essex retainers, because they are formed from the Essex sheet, that the Biostar sheet, in a vacuum molding machine. When the clear aligners come into the place, there from that the clear retainers also come into the place, because in India, basically, that's my personal experience with my cases, that the girls come near about when their marriages got fixed, and then we debond the patient before their marriage date. So if they are wearing retainers on their event or on their big day, it is not visible at all, and it is also doing its work. So clear retainers are the basic solution to what we used to, where we used to give to the patients traditionally, like Holly retainers or the lingual bonded ones. Next slide. Now, I have talked about orthodontia, but my topic is about beyond orthodontia. So, as I mentioned earlier, that because of the soft tissue limitations, we are actually limited to what we can give as a result to the treatment we are doing on the patient. But now, when we have entered into the era of aesthetic medicine and aesthetic cosmetology, we are not restricted with the soft tissue limitations. And one basic reason behind is the Botox. Yes, there are a lot of myths regarding Botox. Botox is something which is not beneficial. We should not give Botox, and there are a lot of myths regarding that. But Botox is helpful for those who are seeking not only the treatment for the teeth, they are seeking overall treatment for their face also. If you are treating a patient of around 35, 40 years, and they have come to your clinic, they have some wrinkle lines on their smile, like this smile area, or they have the wrinkle lines near the your eyes. So if you can treat that, you are giving them overall treatment to the patient, and you're making them happy, because you're not only treating teeth, you're taking the whole face, and which is our department, is the Department of Orthodontics and Dentofacial Orthopedics. So it is not only treating with the teeth, it is also dealing with the face, the soft tissue and the hard tissue altogether. So we all know that the application of the Botox is basically idiopathic rotational cervical dystonia, chronic migraine, teeth grinding, the bruxism, post-stroke, hemifacial spasm, and Bell's palsy. Next slide, please. So this is basically the before and the after. You can clearly see the happy face in the after Botox cosmetic. Next slide. So what are the aesthetic benefits of the Botox? It reduces the fine lines, it lifts your droopy eyebrows, it gives a refreshed appearance. As you can see in that pic, the person look very refreshed. It can also help in the reduction of the gummy smile. People with a gummy smile, they have a lot of short lip position, and their gums actually covers the whole of the smile. So if you're giving a little bit of Botox on that area of upper area of the lip, you are actually giving the fullness to the lip, and that will actually enhance their look. And it will also lift your lips. Now, I was talking about the myth of the Botox, and I will talk about that. First myth is that the Botox is a poison. Well, Botox is not harmful to the body. Okay, there we use the minimum vials. We are not using in a lethal dose. And a typical Botox treatment use only 50 to 100 units at most. It is well under the lethal dose. Okay, second myth is Botox will give you a frozen look. As long as you're receiving the Botox application by an experienced doctor who knows where to inject, how much to inject, in what lines you have to inject, in which segment you have to inject, the technique how to inject, you're not getting any muscle paralyzed. And if you're not getting any muscle paralyzed, then frozen look is not your matter of concern. You will not get a frozen look. Now, the third myth is that Botox will erase all wrinkles. See, there are two types of wrinkles. There are some dynamic wrinkles, that is when you smile, or when you're talking with a lot of expression, like some people talk with a lot of expression on their face, they're very expressive, that is dynamic. One is static smile, that when your face is at rest, then also you have some wrinkle lines. That is because of aging, or your skin texture, or your skin has become very loose because of intermittent weight loss or other multifactorial reasons. So Botox treats the dynamic wrinkles by relaxing the muscles. If you're thinking that it will just improve the appearance, like when you're talking, it will not show lot of wrinkles or lines on your forehead. However, the static wrinkles do not respond to your Botox. So when you're normal and there are some lines, this will diminish to a little bit, but not all wrinkle lines will be diminished. Now, the myth four is the Botox is the only use for aesthetic reason, where this is a big myth. I have already told you there are 20 medical conditions in which the Botox has been given. Now, myth five is the Botox has immediate result. No, Botox does not have the immediate result. Luckily, the result is between 1 to 3 days, and the maximum you can see, the time it takes is 7 to 12 days later, and it keeps up to 3 to 4 months, not more than that. Okay, the next slide. Now, this was Botox. One more thing which is coming for the cosmetology and is mostly used in orthodontia nowadays is fillers. What are the fillers? Basically, fillers are the substance that are injected beneath the surface of the skin to add volume and fullness. As the name suggests, as the name is literally, it will add volume and fullness. And there are different fillers which are designed to do different things. So there are fillers for plumping up your thinning lips. Like there is a patient with thin lips and you have one the pout on the patient, the pump of the patient. Then there are fillers for plumping of your lips. Then enhance the shallow areas of the face, some dark circle on the eyes, and that has doshed the eyes. The eyes look in the sunken eyes are there. So for that, lift and define contours of the face and restore the facial volume also. Like in aging, your face become very thin and V shape and long. So if you want plumpiness or chubbiness of your face, for that fillers soften the look of the scars, any scars on your face. Then it also soften the wrinkles, and especially on the lower face, it is very beneficial. The most commonly used fillers, as you all know, is hyaluronic acid. It is used in most of the beauty products and everything, and it is recognized as the name of Jevederm, Restylane, and Biotero. Hyaluronic acid is naturally occurring molecule found in the body that attracts and retains water. When used properly, these products can add a tremendous benefit to restore, lift, and define the contour of the face. So for facelift also we use fillers. If your face has sunken down, and we use fillers to do a facelift on the face. With the advent of these injectables, orthodontists now have more tools than ever to help a patient to get a better smile and orthodontic outcome. Next slide, please. Thank you. And I hope my lecture has given you another insight of not only sticking your treatment plan to the conventional braces or brackets, but also dealing with the face and thinking in the area of cosmetology. Thanks for having me here.